topic is going to be one can relate to, and that's food and anesthesia. Like, what's up with these don't eat after midnight instructions? So I'm going to go through what the thinking is from your anesthesia provider or whoever's going to provide your sedation. Before you have surgery, you plan the surgery. It's going to be on this date at this time, and they're going to say don't eat anything after midnight unless there's some medications. Usually going to be the instruction of not to eat food after midnight. So what does that mean? So what we do is it's an NPO order. NPO is an anagram that stands for nil per os, which means nothing through the mouth. And what that basically is from the American Society of Anesthesiology has a standards and practice parameters council or committee. The last time the literature was reviewed was in 2015. So this information here, this is a table form of what those recommendations are as far as the types of food and what time to stop them. Those came from the ASA. So when you go into the hospital that morning, there are 3 questions that they're going to ask you, that they should ask you. You're probably going to get tired of answering, and it's just to confirm we have the right patient, the right procedure, and we are doing things safely. The first thing everyone's going to ask you is what procedure you're having. What you don't want to happen is for everyone to assume something different about what's supposed to happen than what you assume. They're going to ask you what your allergies are. We don't want to give you something you're allergic to. The last question is going to be, when did you last eat and or drink? Those 2 questions should be asked and should not be assumed to be together. Important for 2 reasons. What's in your stomach? We don't want to get into your mouth, because if it gets into your mouth and you're asleep and sedated, it could get down into your lungs. If you look at this picture here on the right, and this shows you just kind of what your mouth is connected to your stomach through that esophagus thing. That's your food pipe. On this other side of the screen here, I have a CT image of cutting through someone's chest, kind of cutting through their nose to the back of their head. And you can see there are 2 pipes going down that person's neck, one closer to the spine. There's one tube there that goes all the way down. It goes pretty low. And then there's another tube that looks a little bit short. That long black canal in the back, that tube in the back, that's your esophagus. The shorter black tube in the front of that, that's your trachea or your windpipe. You see how close those 2 structures are. The only thing that's keeping things from going down into your lungs except for air when you eat, something called your epiglottis. When you swallow, your epiglottis is like a trap door, and it closes down on your trachea so that food doesn't get into your lungs. When I give you sedation, you can't close that trap door, right? Because you're asleep. So when you're out to dinner and someone's telling a funny joke, laugh at something, and you and you like almost kill yourself and kind of trying to cough out the chicken, that's you protecting your airway. When you go to sleep under general anesthesia, you can't do that. So we don't want food in your lungs. The other thing we don't want in your lungs is gastric secretion. So your stomach uses acid to start to break down food. Acid's cool for the stomach because your stomach's made for it. So if that acid gets into your lungs, then we have something called aspiration pneumonitis. To not be confused with aspiration pneumonia. Pneumonitis is a chemical process that destroys and can affect the tissues in your lungs. So that's what we don't want. That's why we're telling you to not eat anything. Going back to that chart there. So the first one is 2 hours, clear liquids. Clear liquids or 2 hours means that you should stop drinking liquids 2 hours before your surgery. If your surgery is scheduled for 8 o'clock, don't drink anything after 6 in the morning before your surgery. Clear liquids include like apple juice, obviously water, clear carbonated beverages such as Sprite, ginger ale, even black coffee with sugar. Don't use creamer, even if it's non-dairy. This does not include alcohol. I have to say that. We've had patients that have come in and had tequila. Well, usually I put OJ in it, not alcohol, okay? The next thing is breast milk. Human breast milk 4 hours before. And the reason there's a difference between human breast milk and cow's milk is there are different proteins and fats that are present in cow's milk that aren't present in human milk. So 4 hours for breast milk, 6 hours for cow's milk. The last one is the food. Anything basically that's not human milk or regular, just a glass of milk or clear liquid. That's granola bars, mango, pizza, fast foods. We say midnight because most patients honestly just don't follow instructions very well. So, we want you to come in, we want you to get your surgery done, but we want you to get it done safely. There's some caveats to those instructions though. That is intended for patients that are coming in for elective procedures that are otherwise pretty healthy. If you have any ongoing processes, such as diabetes with gastroparesis, where your stomach doesn't empty out as well or empty out as quickly. If you're pregnant or you have some intra-abdominal process going on, so your gallbladder is bad, you have appendicitis, you have small bowel obstruction. Maybe you have some liver disease and you have a lot of fluid in your belly. If there's something going on in your stomach, you may move food out of your stomach more slowly. So we're going to be a bit more careful with you as far as the instructions for nothing by mouth. Sarcoidosis are some of those connective tissue disorders. Again, because there's this little tube, if we go back to that picture, at the bottom where your esophagus, your food tube meets your stomach, there's something called the GE junction, which is the gastroesophageal junction. And it's a tight little sphincter that closes up so when your stomach is churning food around in it, it doesn't shoot it out your mouth. We don't want that to happen while you're like in a meeting at work. So you have this GE junction. Some of these conditions, sarcoidosis, diabetes, and things, affect how well that sphincter works. The last thing I want to go over before I give you a quick example for a patient is I want to talk about something called ERAS, ERAS, which is Enhanced Recovery After Surgery. And it's actually copywritten society, like that term is now copyright. Basically, it means that we're trying to get you ready for surgery so that your recovery obviously can be improved, but we're doing it well in advance. Some patients, they're working on things to prepare you for surgery weeks, a month in advance. One of those things is this nothing by mouth order that's given to most patients. And what we found is that patients actually do better with wound healing, with anxiety, when they are able to eat or when they're able to take something by mouth in the appropriate times. And especially in surgeries that have to do with the stomach. So colon resections and bowel resections and things like that. They want the function of your bowel to come back as quickly as possible. And it's been shown that like having something in your stomach makes your stomach work. So like starving people is not the way to get good bowel function. This protocol is basically saying with new recommendations, they advocate for carbohydrate loading and hydration before the procedure. And we're just trying to improve outcomes. We're trying to improve your experience, right? So that these recommendations and protocols will come with instructions from your surgeon or whoever is assisting your surgeon. That could be a PA, a nurse. Just be mindful of that new set of rules. And it's not really new. ERAS is not new. It's been around for a while. It's just a new resurgence of it. So here's an example really quick before I let you go. We have a patient that's scheduled for surgery. And let's say he's coming in for a knee surgery. And he's told to come in at 10 o'clock for a surgery that's supposed to start at 12 noon. So you're coming in at 10 o'clock for your 12 o'clock surgery. The last time you can have anything to eat is clear liquids. And that's at 8 o'clock in the morning. 2 hours before you present. The reason this sounds funny, right, because I said 2 hours before surgery, which is the truth, right, is because if your surgery is scheduled to start at noon, you show up at 8. Let's say that morning something happened where the procedure before you was canceled or it went short or things were moved around. We can get you going more quickly. If you've eaten, that could delay your surgery. So let's use 10 o'clock, that the time you're supposed to present is the surgery time that you're going to use to work backwards as far as time. So clear liquids, 8 o'clock in the morning for a 10 o'clock presentation. That means if you have to take any medicines that morning and things like that, we want you to take them at the latest 8 o'clock. Don't start drinking at 8. Stop drinking at 8. If you have a child that is on breast milk, you can move that back a little bit. And the last time they can drink human milk is 6 o'clock in the morning. The last meal, however, is going to be 8 hours before that presentation time. Presentation time is 10. 10 minus 8 is 2 o'clock in the morning. If you don't normally eat at 2 o'clock in the morning or 1 o'clock in the morning, don't just eat. That 6 hour time that's up there, I just want to address that a little bit. That's a lot harder to enforce because it says light meal. And they say, as an example, toast. I think that's a very vague term on purpose because it lets me decide what is a light meal when it's appropriate. And that rule usually applies to patients that are already in the hospital. Morning, they might have got a tray for breakfast where they had some orange or apple juice and a piece of toast, something like that, or some applesauce. And the surgeon says, I need to do this procedure today. If it's not an emergency, what's the earliest I can do the surgery? And then I can say, okay, that's a light meal. For me to give the instruction to a patient when there are millions of you guys out there, what's light for you may not be light for me or your neighbor or even the person sitting in the room with you right now listening. There's too much vagueness in that. That's why we don't give that instruction out to patients usually. But anyway, that's NPO. That's why we tell you to not eat before surgery. We want to protect you from the stuff getting in your lungs. If you have questions about this, you can, put them in the comments. I'll check them out. But really talk to your doctors, right? This information, again, as the disclaimer shows, is not meant to be medical advice. It's meant to help you to understand things. Go to your doctor a little bit more knowledgeable about things. But ask your doctor, ask your surgeon, your anesthesiologist. Thanks for listening. Talk to you later.